When it comes to ureteric strictures, patients need to choose between a double J, which they need to replace every few months along with pain in sleeping, peeing, and exercising, or the other option of a long definitive or radical surgery with risky and irreversible complications. If successful, then long recovery and pain. Second surgery success rate drops to only 30 to 40%. Patients are left with no minimal invasive solutions for post-prostatectomy strictures, and for bulbar strictures, it's either repeated urethrotomies or a surgery. Meet Allium, your long-term solution for any type of urologic stricture, internal, external, benign, and malignant. Allium stents are the optimal solution to keep your patients happy at home for years. You can finally choose a solution for first line of treatment that would have high chances of success in curing benign strictures in ureter and urethra. Allium stents are reversible, while doing it wrong in surgery is irreversible. Allium RPS is the only viable minimal invasive option for post-prostatectomy strictures, and BUS for bulbar strictures is a great alternative for urethrotomies. If you think about money, over the course of 3 years, the doctor will be replacing 6 to 10 double Js, which are much more expansive than only one Allium stent in this entire period. Insertion is easy. With Allium ureteric stent, the URS, first, you insert a dilation balloon, access sheath, or mechanical dilators over the guide wire and dilate to at least 14 FR. After dilation, you irrigate the URS delivery system with saline water and insert it over the guide wire to the right position on X-ray and deploy. To remove the stent when needed, use this technique with the largest jaw rat tooth or alligator forceps you can find. Make proper follow-ups always to avoid complications with removals. Follow Allium Tips and Tricks short movie for insertion and removal techniques. We have one system that fits to all 3 Allium urethral stents. Very easy, no need for guide wire, just cut the stricture with cold knife or dilate it, insert the system, deploy the stent, and pull the system back out in rotational moves. To easily remove those stents, use the grasper too. Consider Allium URS stent for first-line treatment in the following cases. Patients with benign strictures for potential cure of 70 to 80%, in case of a high risk for surgery or anesthesia, fistulas, palliative, post-renal transplant, and patients undergoing radiotherapy who with Allium will continue radiotherapy the day after, as opposed to surgery in which they will go through weeks of recovery without radiotherapy while tumor can grow. Second-line treatment is of course recommended for Allium URS as well. For BUS stent for bulbar strictures, consider it immediately after first urethrotomy or dilation. Second, to avoid many recurred urethrotomies. Third, after recurred stricture post-urethroplasty. This is Sam. He has colorectal cancer and a radiation-related stricture in the ureter. Doctors are considering to remove the stricture with surgery. In this case, Sam may face weeks of recovery time with no option to treat his tumor. After choosing Allium, he continued radiation the day after. This is Sarah. She has a 10 centimeters benign stricture in the ureter, causing her hydronephrosis. Every few months, Sarah faces another procedure to swap her double J stent with another after not being eligible for a surgery. She's having pain with it when peeing, sleeping, and exercising and not having enough drainage. She has even experienced blood in urine. After choosing Allium, Sarah's life is back on track. No more frequent replacements, no more sleepless nights, a stent that stayed there for 3 years with normal peeing and full drainage. This is Agnes. She has a low risk for surgery and a 1.8 centimeters ureteric benign stricture in one ureter and 3 centimeters fistula in the other. She had to choose between a surgery and Allium URS stent. Doctor convinced her Allium is reversible, long-term treatment with enough clinical validation to have 70 to 80% curative effect for the stricture and 92% success for the fistula. She ended up choosing Allium. Her stricture resolved within just 1 year, and her fistula was sealed regeneratively over the stent in just 6 months with no further need for treatment. With Allium, you can be sure that you are well informed about all necessary information with innovative and updated website, brochures, clinical publications, and much more. We even built an app for you to use before, during, and after procedure. All you need packed just for the procedure, so you can focus on what matters most, your patient. With us, you are never alone. You are part of our community. Doctors grow with us as our KOLs and become much more than users. Over 40,000 patients have already reached their peak of their health thanks to Allium. Allium Urological Solutions, engineered for excellence, anything but mainstream.